The COVID-19 pandemic has had an outsized impact on women in Canada. The gendered pay gap in this country was already massive, and according to some recent studies, on average, women make around 70 cents on the dollar that men make in this country. Women from racialized communities, new Canadians, make even less than that. And now stay-at-home orders limit the work opportunities and force an increase in the unpaid labor that many times is performed by women in homes across Canada. Women are more likely to be working lower paid and more dangerous jobs on the front line of COVID-19 in grocery stores, hospitals, long-term care homes. It's also led to a rise in the risk of gender-based violence. Now with stay-at-home orders and lockdowns, women, girls, trans, and non-binary people face heightened risks of abuse and domestic violence in their spaces. In Barrie, the Women and Children's Shelter helps women leaving situations of domestic abuse and violence. I checked in with Katie Taylor from the Women and Children's Shelter of Barrie, and here's our conversation. We speak about the shelter's adjustment to COVID-19 protocols and how that's caused challenges for how the shelter addresses the needs of women in Barrie who are leaving abusive situations or women who need shelter.
To start off, can you introduce yourself, your role, and then also just a little bit about the work that the Women and Children's Shelter of Barrie does?
So, hi, I'm Katie Taylor. I'm the development manager here at Women and Children's Shelter of Barrie. The Women and Children's Shelter has been in existence in our community since 1981. We are a 27-bed emergency shelter, and we also provide emergency shelter, but we also provide services for women in shelter and as well as outreach. We provide counseling, individual and group counseling, court and legal support, as well as referrals and other programs within our shelter as well as within the community.
Now, I know you haven't been there for the whole 40 years the shelter has been operating, but from what you can tell, what place does 2020 have in the history of the shelter? How has 2020 kind of changed how the shelter operates, or what challenges did it bring?
So initially, when the pandemic first broke, we were scrambling. There was the challenge of both finding ways to isolate and to keep women socially distanced within the shelter, the women that were currently in the shelter. And so that looked like actually relocating them to different hotels and motels at the time. Obviously, that wasn't feasible for the shelter. So we have since made decisions, and those decisions look like we operate at a lesser capacity. The shelter, when I say 27 beds, that does mean shared rooms in some instances, shared bathroom in some instances, and of course, we all know COVID safety and health reasons that just can't be allowed. So we are operating at a lesser capacity.
How did that feel like for you and your teammates to have to kind of change so much of what you do? Or
I mean, the feeling really isn't about how we feel. It's more the need for the women who are escaping violence within their home. And again, initially, there would go periods of time where there would be an increase in calls and the intensity of those calls, but just as frightening, there would be lulls. And so appreciating that women in their homes who are experiencing violence and abuse didn't escape, obviously can't escape, or don't feel comfortable enough to leave that place and risk contracting COVID in a congregate type shelter setting.
the normal way that women who approached you for your services and for your help before COVID, has that kind of changed now? Has the way people kind of interact with the shelter and kind of come into the shelter changed as well?
So there's a few pieces there. So obviously we have our emergency 24-hour crisis line, 705-728-2544. For anyone who is even watching this now, if you are experiencing abuse, or if you know of someone who might be experiencing abuse, our frontline staff and counselors are here to listen, even if you're calling on behalf of someone and you want resources and information. So that piece hasn't changed. Of course, people coming into the shelter were at risk, and so the women that are in our emergency shelter, there are, just as any place that we enter, there's different protocols, there's screening. If, especially now with lockdown, if you choose to leave to a certain extent, we do ask that you self-isolate in your room. So yeah, I mean, even the food, we have a large kitchen, and of course we're encouraging women and children to their own food preparation, but during COVID, that's just not an option. So pretty much operational wise, every element we've had to we've had to revisit, relook at, and plan accordingly.
As far as the kind of the external operations, as far as fundraising, galas, getting people to donate, how has that been impacted by this past year?
Obviously, physical events are null and void. We do find, though, that whenever we do have a need, and we're 75% government funded, so there's a large chunk of funding that comes from the community. But when we need, the community steps up tenfold, and that was so prevalent over the last year during COVID. And I think that might have come from a place of people also feeling kind of hopeless themselves, and maybe there's a different level of understanding, and just feeling the need to help. So even though we're obviously disappointed that there's certain events that can't happen, we've been creative with switching to virtual events. And we have our Shelter Me program that kind of promotes sustainable funding through monthly donations. We encourage legacy donations. And yeah, just again, it goes hand in hand with the public awareness. So although these fundraising events are so important for us to be able to just operate, just as important is this type to explain what we do here and why it's so important for anyone in the community to.
Just to circle back to something you said earlier, you mentioned that sometimes you haven't been getting a volume of calls that you expected, and that tells you some worrying things as well. For people who may be watching, could you kind of explain a little bit more about that? A little bit more about how the call volume and what it tells you about people experiencing gender-based violence in Barrie?
As we know, we're not interacting with the same people that we typically would be on a daily kind of typical basis. So there's no opportunity for any check-ins for women who are experiencing violence at home. The women aren't bringing their children to school. You're not seeing them at work because they're working from home. They literally are locked in their homes with their abuser. And oftentimes, prior to the pandemic, there can be difficulty with trying to communicate in that setting. So, of course, this is all impacted and compounded. And so, if anyone is needing assistance of any kind, again, we are here to just listen and to just offer support in any way, and that's essentially, our main goal is to obviously provide refuge from women who are experiencing gender-based violence, but of course just help plan either escaping or help planning the next stage in that journey for those women.
And from your experience this past year, what does that next stage look like? I'm sure it's different for everybody, but as far as women who come to your shelter, What are some options about what's next for them?
Yeah, so that's a great question. We are in the process of looking for a second dwelling. And so when women come to our emergency shelter, they typically don't have any other options. They don't have family members to go to, and financially, they're just unable to rent or purchase given their situation. So on average, women will spend about 3 months in shelter. And that number obviously could change depending on the situation. And affordable housing, especially in our community, is scarce. And sometimes those affordable housing options, abusers can easily access those spaces or even live in those areas. And so what we're looking for is an opportunity to extend the stay, if you will, for women in the shelter. So this is an opportunity for women to kind of get their feet wet, with still having the support, the full network and support of shelter services, but be paying and contributing and trying to live their best lives.
And from what you have seen, how does the impact of the community around these women who come to your shelter, how does that community help them forward?
If the women know their worth and they know that there are options and they know that there's a level of understanding and respect, and knowing that it's not her fault, and again, kind of knowing the cycle of abuse and just, yeah, I do feel like it, if not you, then who? If you don't care, then who cares? And it does take it takes a village, it takes a community to end the cycle of abuse. So in any way, whether it's hosting third-party events for both the fundraising element and the awareness piece, whether it's asking us to present, whether it's, there's so many different ways that community members can get behind us and rally and support women and their children.
Yeah, and as you mentioned earlier, the affordable housing crisis in Barrie is very real and present. I was wondering, could you dive a little bit more into how that crisis might intersect with the lives and the problems that these women are facing, and how maybe that makes it harder for them to get their feet on the ground after leaving the shelter? Does that have a relationship?
Yeah, there are many intersections: mental health, substance abuse, of course, finances, affordable housing. But affordable housing, shelter is a big part of life. And so not being able to call a place your home and feel comfortable and safe in your own space, it does start there. So women and children shelter seeking this extra level, if you will, of safety and protection for women. And again, it's twofold. It's allowing the opportunity for these women to continue on their journey, but it's also allowing space for women who otherwise might not be able to come into shelter. And so prior to COVID, the shelter on any given night would be full. And so we would average about 500 women annually that we would have to turn away to either other shelters or other safety plans. Obviously, that number, with us having to decrease our capacity, will have increased significantly. But yeah, so affordable housing, of course, but again, it's just that opportunity for extra support, and again, knowing how long and how many times it takes for women to escape their abuser, having an opportunity to help with that journey for that woman is vital.
Are there ways that you'd like to see the city of Barrie or the county of Simcoe kind of partner with you in different ways this coming year to help you with your work or to provide more opportunities?
The city and community partners and agencies, we've had incredible relationships with everyone. We're appreciating everyone is doing their best. Everyone else is going through very challenging times right now. And we continue to have conversations and continue to expand and to explore options. But it's very uncertain right now. So just respecting and appreciating where everyone else is, but knowing that it's been referred to as a pandemic, shadow pandemic in its own. The crisis of gender-based violence has existed far beyond COVID. And so it's fortunate sometimes that COVID has maybe brought it to life in certain ways, but also understanding that this has been a long struggle, a very long struggle.
Now, for a lot of people who have not experienced gender-based violence or are not familiar with a lot of these problems and really tragic situations, do you think people miss aspects or don't understand aspects of those dynamics and how they might work during COVID-19?
Again, even with donors, if there's ever an opportunity prior to COVID, something that we would offer is a tour of the shelter. There does seem to be a disconnect, myself included, prior to working at the Women and Children Shelter, as to what actually goes on in a shelter and the services that are provided beyond the emergency shelter setting. So giving our community members an opportunity to really understand and comprehend and see the children playing in the playroom and doing their after school homework, playing outside, the women hanging out, reading a book. This is their home for a good chunk of time, and they've witnessed, their stories are really traumatic and incredible. And so for someone who might not understand it, if there's ever an opportunity, and that's the awareness piece and the educational piece, if there's ever an opportunity to have this discussion, to have a little bit of better understanding as to, it's not about the survivor, right? It's more about the abuser. And so for us to educate in any way, we take that opportunity. We do have a violence prevention program that is aimed at youth and kind of offers topics anywhere from consent to, a little bit more intense topics like sexual assault and rape culture. But these conversations are so important, especially starting with the youth and having these conversations in school and, at home. And so, it's just a constant dialogue.
Yeah, so it's like some people might think that the Women and Children's Shelter is a place where people come escaping abuse and that's all, but it sounds like you partner with women and their families throughout the whole process, even in prevention, all the way from kind of setting them up and building up capacity for them to kind of continue on in the community, right?
We're providing them the tools that they with a being in an abusive relationship, you lose yourself. So it's an opportunity to empower them and provide them with the tools that they may have already had, but haven't recognized. And so it's absolutely, it is a journey, and it's an ongoing journey. And if you listen to survivors talk, it is really encouraging and empowering to see stories of hope, essentially, for those who might be experiencing it right now.
Well, I think those are all the questions I have. Before we ended, I just wanted to ask you, is there anything that we didn't cover that you'd want people to know, or anything about the experience this past year?
The only thing I'll just invite people, we are, for International Women's Day, typically we would host a big rally in downtown Barrie and invite all of our community groups and partners and women and family and children. Of course, that's not happening this year. With International Women's Day, we also did a luncheon. Of course, that will shift to virtual. So we'll be launching that fundraiser beginning of February. And of course, any shelter updates and news, you can visit our website at barrieshelter.com. We're very active on social media. So yeah, if you're looking for information, resources, again, the crisis line is 705-728-2544.
Perfect. I just want to ask you one as well. I saw on social media the call for that home and building up capacity there. Have you got any feedback from that, or is there any next steps in that process, or is it kind of still planning it out?
We're still planning it out. We're still hoping that there's an angel somewhere that will say, you know what, I have something that may work. We've been talking to some groups, some individuals, but nothing's really panned out yet. So yeah, we are still actively seeking.
Well, thank you so much. I really appreciate your time and explaining how the shelter works and a little bit more about that too. So I really appreciated it.